This will really help you for your exam. So, our patient is Homer Simpson. Presents you out your here's our goals. We're going to scan and verbalize multiply how multiple myeloma affects the body. We'll understand the risk factors. They'll be able to understand the symptoms of the disease. Also be able to verbalize the symptoms to a care provider, and also understand some self-care strategies. All right, so multiple myeloma is a condition where the plasma cells in the body become cancers. Neoplastic plasma cells invade your bone marrow and destroy the bone. The malignant plasma cells continue to multiply at a rapid pace. The plasma cells produce two things that kind of create this cancerous situation. Abnormal and excessive immunoglobulin M normally is good for your immune system, but either produce an excessive level. Also cytokines, which also help in the destruction of your bone marrow. And then as it continues to grow, your normal plasma cells decrease further and further, therefore making it a worse situation for the immune system. And the reason why cancer cells, don't function normally, I believe some of you probably know some of this already. They don't die. They don't communicate with other cells. They don't have to be attached. They just keep proliferating over and over again. And they just keep growing without regard of how dense they become. And the problem with multiple myeloma is they develop very slowly. And by the time it's found, it's pretty far progressed. There's certain ways that it's found, looking at hypercalcemia, X-rays showing like bone fractures, certain blood levels with albumin and B microglobulin.
Yeah, with multiple myeloma, Dave talked about it. Plasma cells in the bone change. You go to different bones all over the body. Less than 5% plasma cells is normal. This goes to over 10%. We don't know why it's happening. They have no idea. But it has some possible causes or possible risk factors. There you go. Radiation, chemicals, metals, herbicides, pesticides. There's also some genetic factors with it. 40% of people with multiple myeloma have one of five distinct chromosomal abnormalities in the test that you can get if you have multiple myeloma to find out what your chromosomal abnormalities are. Big risk factor for this is age. The majority of people diagnosed with this are 69 or older. Black people have twice the rate of multiple myeloma as well. Men are more likely to develop multiple myeloma. It's about 55 to 45 for men and women, so not a big difference. And then obesity is a big one. So over 30 BMI is twice as likely as people 22 or less BMI develop this disease. And the biggest incidence of this is people, farmers and agricultural workers that are around pesticides and stuff, as well as rubber, leather, paint control workers.
Talk a little bit about the signs and symptoms. Multiple myeloma is slow in its development, and the symptoms typically don't manifest or show up until the disease is already in its advanced stages. The primary side effect is skeletal pain. Often centralized in the pelvis, spine, the ribs, and ultimately the skull, and is typically triggered and exacerbated by movement. Osteoporosis becomes a problem because the myeloma cells are essentially breaking down. They're triggering the body to break down bone faster than it's being built, which leads to osteoporosis. Neuropathy, which is nerve damage. Myeloma proteins are toxic to nerves, so once they start to build up, you might experience weakness and numbness. Vertebral destruction, as the bone starts to kind of fall apart, calcium essentially in the blood. Bones have a lot of calcium in them, obviously, and as they're destroyed, they're released into the blood. And that can, in itself, lead to a variety of problems. It can involve kidneys, it can involve digestion, brain function. The patient is also going to be susceptible to recurrent infections because of, again, bone marrow activity is compromised, and bone marrow is normally going to be producing the white blood cells to help fight infections. Well, that may not be as plentiful once multiple myeloma takes hold. You're also going to see anemia, again, related to the alterations in bone marrow. Blood cells just aren't being produced at the same levels. Signs and symptoms to report to a healthcare provider. Skeletal pain, again, that's one of the key symptoms. And during movement or moving around, it's very painful. That is one of the first symptoms of this. You have recurrent infections. Abnormal weight loss can be expected. Weakness, again, with the nerve damage. And then you have leg edema, shortness of breath, polyuria. And all of these things are related to the gradual failure of the kidneys, which is due to those excess calcium and the proteins that are being produced by myeloma. So, in essence, there's a broad spectrum of symptoms that you might experience. Any one of these is probably going to be severe enough for you to want to report that to the healthcare provider. Now, Austin is going to discuss self-care.
Since in most of the, I kind of know what the disease is and everything, the self-care we're going to be giving you today is based on the drug therapy you're going to be going through. Some of the side effects of the drugs are going to be peripheral neuropathy, blood clots, a low white blood cell count, which will hurt your immune system, constipation, and fatigue. First of all, peripheral neuropathy, it's just kind of like a tingling or loss of sensation in your limbs you might feel. Some of the things you can do around the house for more safety would be to have someone check the shower before you go in, remove loose rugs from hardwood floors or linoleum, kind of put a shower pad in, like a mat on the bottom of the tub, and use pot holders in the kitchen. For blood clots, try not to sit for long periods. Try to get up and take a walk. Of course, your bone pain might make you not want to do that. So something you can do is just stretch your calves instead if you're sitting down for long periods of time. You can start by lifting your heels and then lift your toes, and that'll kind of get your calves moving and try to get the blood clots going through. Low white blood cell count, so it's going to affect your immune system. If you have loved ones that are sick, ask them nicely not to come in because it could hurt you. Also stay away from crowds, shopping malls, stuff like that. Be really careful about cuts and you get because any infection could really do a lot of damage to you. Constipation is another kind of symptom of these, some of the drugs we'll be taking. So just remember to eat some high fiber foods like fruit, veggies, whole grain bread, stuff like that. Stay well hydrated. Drink about 8 cups of water a day will be good for you. Staying active is important. It will also help with fatigue and your general well-being. So try to fight through the pain a little bit, and that'll really help you out. Also to help with fatigue is going to be some high protein foods. Make sure you have foods with iron because anemia, of course, is a problem with cancer and drug therapy. If you need to take a nap, go ahead. It's okay. And then, of course, emotional coping. This is going to be a battle for you. So remember to share your feelings with your family and friends. Don't be ashamed of negative thoughts. You're going to have good days and bad days, so you don't always have to be feeling good, but know that you have a support team. And if you are worried about burdening your family and friends, or if you think that they might be tired of hearing about it, there's support groups that you can go to that will help you. There's the cancer.org. It's a great outreach in the community. Go down there and there's kind of general national numbers, and then they'll get you to a local place. We also got you this pamphlet here for you to take home. It's the American Association for Cancer Research, and it's got the telephone number for American Cancer Society on there. Call that, and they have cancer information self-care for cancer that you will do, self-care strategies.
Take it now.
Yeah, very good, very good. Infections, very nice. Okay, thank you. Good work.
How about some signs and symptoms you might run into?
Skeletal muscle pain.
Very good.
Neuropathy.
Neuropathy. Yep. How about infections?
Got that one too.
There we go. Okay.
Any risk factors for multiple myeloma? Age is the biggest one. Yeah.
And what type of cells are impacted by multiple myeloma? Plasma cells, and what are the plasma cells doing? Where are they going?